February is Heart Month, and not just because of Valentine's Day. No, we're talking about heart health. And with us today from the Heart and Stroke Foundation of Saskatchewan, Elise Bouchot. So thank you, Elise, for joining us today.
Oh, thank you so much for having me.
Now, you are the manager and an RN in charge of outpatient cardiac care in Saskatoon. And we're going to talk about a number of different subjects. But first off, let's talk about the diseases themselves. We hear that 80% of heart and stroke situations are preventable. So what risk factors can people control and what can't they control?
That's a great question. And, our risk factors fall into three categories. We have lifestyle risk factors, and we have medical risk factors, and then we have non-modifiable risk factors. So our lifestyle risk factors, these are the ones that we can address to try and prevent heart disease. And these look like, smoking or vaping habits. They are the foods and nutrition that we consume. So looking for diets that are full of fruits and vegetables and really looking at reducing our sugar and our salt intake. Physical activity is a huge one. We know that only about half of adults get the recommended 150 minutes of activity a week. And so that's a really big one that we can look at addressing. And other ones that we can change are limiting our alcohol consumption, making sure we're getting enough sleep. But when it comes to medical risk factors, these look like diagnoses of high blood pressure, diabetes, or high cholesterol. And those ones we can help manage or control through medications. And then we have non-modifiable risk factors, and those are the ones we can't control. And those come down to genetics, so that's a family history of heart disease, our age, our sex, or sometimes even our ethnicity can play a role in that as well.
Now, we have got about a minute left here. The world is full of misinformation. Is there one misconception, particularly when it comes to women, that you'd like to dispel when it comes to heart disease?
Another great question. So we have always kind of thought that heart disease is a men's disease, and the rates for men are decreasing, but actually heart disease is the #1 cause of preventable death for women worldwide. So women have the same risk factors plus additional risk factors, and it's really important to know those risk factors so that you can help manage them and be aware.
We're just out of time right now, but if people want more information on how they can help themselves, where can they go?
Oh, they can go to the heartandstroke.ca to their website, and they have a great risk screening tool on there, easy to use, and helps move you towards action to preventing heart disease.
Fair enough. Elise Bouchot, thank you so much for your time today. Once again, February is Heart Month, and Elise was with us on behalf of the Heart and Stroke Foundation of Saskatchewan. Thanks again.
Thank you.